Hi again, everybody, and welcome to Retirement SOS. My name is Ernie. And if you're not feeling well, by the end of this video, you're going to be feeling worse. And before we start, just remember these 5 words. Bigger doesn't always mean better. Bigger doesn't always mean better. And just like in life, when you think everything is okay, the unexpected happens. Correction, the unimaginable happens. And out of nowhere came the announcement that Ontario is facing a critical shortage of medical supplies for home care patients. Not only specialized supplies, but even your most basic ones like bandages and gauze. And I guess the million-dollar question is, how the heck did this happen? So when you opt for home care to get your treatments, the provincial government is ecstatic because it saves them a ton of money. Think about it. Home care means you're not tying up valuable and costly resources in hospitals. And it's a win-win situation for the patient and the healthcare sector. And in order for home care to be successful, we as taxpayers rely on trust and expect the government to uphold their end of the bargain. And that expectation was recently broken when the provincial government changed the rules of engagement. And it was a bold move, but unfortunately one that's failing. So here's what they did. Home care medical supplies for years were delivered by small pharmacies and medical supply stores to homes throughout the province. And they each served a small geographical area. Unfortunately, this method of distribution was quite costly to the province. And in order to save money, the Ontario government recently got rid of the smaller suppliers and brought in 3 large vendors who advocated better buying power, the latest technology, and better tracking systems. And they promised huge cost savings for the province. Sounds good on paper, doesn't it? Well, we've all experienced that scenario in our careers, and we know what looks good in theory sometimes doesn't quite translate when implemented. And that's exactly what happened. The U companies weren't ready to start. And my guess it was a combination of misreading the marketplace along with inventory mismanagement that led to their downfall. And as a result, we now have shortages of syringes, needles, tubes, and numerous other key medical supplies. Now, I do believe the province had good intentions when they changed vendors for home care medical supplies. I mean, after all, saving dollars is important, and all governments are under pressure to do so. But the number one priority when it comes to health is servicing your ill customers. In other words, we have to ensure our nurses and doctors have the tools and materials they need to take care of their patients. And after all, it could be a matter of life or death. So let me end this video with the way I started. Bigger doesn't always mean better. Now you understand why. And that should be a big takeaway for every provincial government in Canada that oversees the distribution of critical services and supplies. And as the population of seniors spikes, the demand for home care treatment is only going to increase over the next few years. And as a result, we can't allow a repeat of these mass shortages to ever happen again. So thank you for watching. So until next time, bye for now.